Um, I'm gonna discuss the use of PROMs, patient-related outcome measures, in routine clinical practice, and now we have an experience in not only in Paris Center but in the whole PH network in France. So that's my disclosures. So just to start with this cartoon about summarizing what is the treatment goal. What is the treatment goal for a doctor? For a doctor, the treatment goals are as follows: improve survival, reduce hospitalization, improve RV function, improve exercise capacity. And finally, as you can see, the improved quality of life is on the bottom. Of course, if you what is relevant to patients is, of course, very, very different. And for the patients, improved quality of life is on the top of these expectations. Improve daily life activities, tolerate medication and minimize side effects, avoid hospitalization. And finally, the majority of the patients, they don't care about the RV function. What is important for them and for you are to improve the quality of life. And as you know, at the last World Symposium in Barcelona last year, we put the patient's perspective as the task force #1. And Pisana and Giorgeli and some others participated to this very, very important task force at the last World Symposium. You know that PAH is as severe as other serious debilitating condition, and the impact on health-related quality of life is very, very important. As you can see here, this is the scores from the SF-36, physical component and mental health component. As you can see, PAH here in gray is as severe as we can see in COPD, ILD, cancers, and other debilitating conditions. And also, we know that a significant proportion of patients with PAH or with PH in general experience mental disorders. And if you look at any mental health disorder, 1/3 of the patients experience this kind of disorders because there is a big impact of the disease on the mental health. And we also know that the patients with PAH suffer from depression, anxiety, and stress. And we can observe this at any stage of severity of the disease, mild, moderate, severe, or extremely severe symptoms. As you can see, the patient, some of them, they have depression, anxiety, which is much more common, and stress. So that's why it is also very important to assess quality of life, which is, we know that it's very broad, complex, and subjective. And we know that it is very, very individual. And the perceptions are very, very individual regarding the health risk and condition, functional status, social support, socioeconomic status. So we can assess this from how are you doing today, which is the simplest way. Functional class is very, very commonly used to assess the kind of quality of life, but we also go to the real health-related quality of life and PROM, patient-reported outcomes measures. Let's start with functional class. We know that functional class is very, very difficult to assess. What we call sometimes WHO functional class, which does not exist. It is NYHA functional class. I just want to say functional class. So we know that to consider functional class 1, 2, 3, or 4, the many physicians, they do not consider just the assessments of functional class. They consider other variables to assess functional class. They consider hemodynamic values, they consider physical examination, 6-minute walk. If you have a patient walking 200 meters and claim that is in functional class 1, is probably not true. So many physicians, they consider other findings of other metrics to assess functional class. And this is an interesting paper. It has been published 15 years ago, about some 10 patient case scenarios analyzed by PH experienced physicians and nurses. And as you can see, in both physicians and in nurses, in some scenarios, we have physicians, for example, for this patient number 6, for the same scenario, 2 physicians considered that the patient was functional class 1, some other functional class 2, functional class 3, or functional class 4. So it is very complicated to define functional class, and there are significant variation in the clinical case assessment of functional class. That's why PROMs have been introduced to assess the not only symptoms but also quality of life and some impact of the disease on psychological impact, physical impact, social impact, and that's what PROM are made for. And we also can use PROM in interventional clinical trials or as quality indicators, but today we have to concentrate on the use of PROM in routine clinical care. We know that PROMs have been used in routine clinical care and research for PAH, and this is a list of some PROMs. You have the non-specific PROMs like the SF36 or the EQ5D, and we have a list of PH-specific like COMFOR, Omphazistine, Living with PH impact which have been developed especially for pulmonary hypertension. All those questionnaires of PROMs, they correlate with very important metrics like walk test, functional class, BNP, sometimes hemodynamic survival as well. So I think there are good correlation with very important metrics, and we also have different methods to assess those questionnaires. Like for example, for Omphazistine is a 6-point semantic differential methods. For living with PH, that's a 6-point Likert scale. So and the time to complete and to fill the questionnaire is very variable from a questionnaire to another. Let's start with the SF36 questionnaire, which is non-specific. We have some component, a physical component score, and some mental component score, including mental health or emotional, social functional vitality, etc. We know that the pH management, this is an example in the Seraphine trial with macitentan, that when we give the drug, it's better than placebo in terms of improvement of the component of the SF36 scores. As you can see here, in red, that's the treatment, it's better, and in gray, that is the placebo, which is worse. So we know that with the treatment, we can improve the component of the SF36, and this is also correlated with the outcomes. This is not the survival, this is the time to first confirm morbidity or morbidity event. And according to the median baseline SF36 component, either physical or mental component, this is highly associated with outcomes. And let's move to another PROM, which is the pH SYMPACT. The SYMPACT is a specific patient-related outcome tool developed in accordance with the FDA PRO guidance. It evaluates 11 pH symptoms and 11 impact items. These include cardiopulmonary symptoms, also cardiovascular symptoms, and in terms of pH impacts, not symptoms, but impacts, it assesses physical impacts and cognitive and or emotional impacts. I don't want to go into too much detail. It works, and if you look at the different domain, cardiopulmonary, cardiovascular, physical impact, cognitive or emotional impact, there is a very good correlation with functional class, for example. So when you have the patient in functional class 2, it's better than to have functional class 3 and functional class 4. It's obvious for cardiovascular symptoms or cardiopulmonary or cardiovascular symptoms, but also it correlates with physical impacts or cognitive impacts. It's also interesting because it changes over time, and when you have patients who decline or who stabilize or who improved, as you can see, we have different evolution of these different symptoms or impacts. Let's move now to emphasis 10. Emphasis 10, that it is what we use now we are using now in the French registry. Emphasis 10 have been developed in the United Kingdom, and it measures the impact of pulmonary hypertension of quality of life. It has been developed from interviews conducted with 30 PH patients, and as I mentioned previously, that a semantic differential 6-point scale from 0, 1, 2, 3, 4, or 5. And we have 10 questions, six kind of response, and the patient, it is a self-administered questionnaire, and the patient is doing this, for example, during the outpatient consultation. It is very, very sensitive to difference in relevant clinical parameters. It is freely available, and it has been translated in 25 languages. In France, that we are using, here we have the French translation of the emphasis 10, and it has been used now. It is used now in the French PH network since January 2024, less than 2 years. Now we have been able to collect more than 2,280 emphasis 10 score recorded in almost 1,500 patients, including 230 incident or newly diagnosed patients and 1,200 prevalent patients. More than 461 patients had filled 2 or more questionnaire, including 8 or almost 100 with baseline assessment, baseline, first follow-up, second follow-up, etc. So it's very important to follow regularly those patients, also with the quality of life questionnaires. This is the patient demographics, majority of female, 58, and 42% male. The mean age was 62. We have a majority of patients with PAH, but also a significant proportion of patients with group 3 or group 4, CTEPH. We have 230 incident case. And if you look at the outcome now, we have 44 patients that died and 11 underwent lung transplantation within the 2 years follow-up. This is the patient characteristic according to all the emphasis tests that have been filled. So we have a majority of patients in functional class 1 or 2 because that majority of prevalent case that patient already treated. The 6-minute walk is broadly 400 meters. Here you have the median for the BNP or NT-proBNP. This is within the normal range, but just for the median. And here we have the hemodynamics of the patients. Also, the hemodynamics is not that severe because we are looking of the emphasis 10 score in patients in prevalent cases. If you look at the correlation, we found a very weak correlation with pulmonary hemodynamics and NT-proBNP, which are very, very important metrics in PAH. But we have a quite nice correlation with functional class, 1, 2, 3, and 4. This is the score of emphasis 10. But as you can see, you have also a huge distribution. And for example, in functional class 1 patients are very good. The majority, they have a low score, less than 10 or 20. But some of them, they also have a high emphasis 10 score. If you look at the correlation with the 6-minute walk distance, there is a correlation, but as you can see, the distribution is very big, and you have a huge variation for the same level of emphasis 10 or the same level of walk test. For example, 400 meters, you have patients with a score of 0, and some of them, they have score of 50. So I think we have there is a correlation, but the distribution is very, very broad. This has been already shown in the UK registry. There is a good correlation with the functional class again here in these two papers published from the UK registry. In the French registry, we look also at the correlation with the risk. You know that you can assess the risk with some metrics like functional class, walk test, and BNP or NT-proBNP. And according to the risk, the higher the risk, the higher the emphasis 10 score. But that's only mean and standard deviation. And if you look this on the right-hand side here, you have huge variation in the emphasis 10 score according to the risk, and you have patients at low risk with a low emphasis 10 score and some other with a high emphasis 10 score, and vice versa. So yesterday I saw 2 patients, young patients. One was with almost normal hemodynamics on therapy, and the emphasis 10 was 40, sorry, which is very, very elevated. And in contrary, on the opposite, I have another patient with very low emphasis 10, 13, which is very, very low, and a very, very severe hemodynamic. So it's difficult to have a perfect match between the clinical status, the hemodynamics, and the emphasis 10 score, because probably emphasis 10 score or PROM say something different than the classical metrics we are using to assess for example, the effect of therapy in patients with PAH. And this is also the data from the UK registry showing that there is a good correlation between the emphasis 10 score and the outcome. But this is, we did not have the same analysis in France, but we will do it soon. So this is my last slide about the clinical use of PROM in pulmonary hypertension. This is a slide, a picture I took from a recent paper published in the Journal of American College of Cardiology. And as you can see, what is interesting for us, that patient care, the clinical use of PROM. This is a development of PROM, and this is when you are using PROMs in patient care to assess clinical status for prognostication, to assess treatment response, perhaps, to also to look at the patient-physician communication, which is also very important. And here you have the pro and con of the 3 PH-specific PROM. For example, emphasis 10 has excellent feasibility for clinical use because it's very concise format and easy interpretability. PH impact has been developed according to FDA standards for clinical trials, but there is limited data on interpretability and feasibility in clinical practice. And COMFOR was the first developed PRO, but is very long. There is very, very long completion of time. Otherwise, COMFOR is also, we have to pay to use it, which is also an issue. So the majority now of people, they consider using emphasis 10 because emphasis 10 is very, very simple, and that has been also developed within the ear and lung. And within the ear and lung, the PROMs are very, very important to consider, and that's why we decided to use emphasis 10 not only in the French registry but also in other centers participating in the European Rare Network dedicated to the lung, and in particular in the PH-core network. So thank you very much for your attention.
Thank you very much, Professor Sitbon. That was excellent presentation. We had one question, or a few questions actually, to ask you. Do you use the results of the PROMs in your consultations? Meaning, do you discuss the results with the patient that you're seeing and use it to get to know kind of what their real struggles or daily challenges are? And do you use it in treatment decisions?
Yes, very important question. So we use regularly the results of the emphasis 10 in the consultation. We have to learn more about the emphasis 10 score, because as I mentioned, we have patient, we have very good outcome, very good results with the treatment, and sometimes we have very high level of emphasis 10, very high score. High score means there is something wrong. So, and we have to, this help us to look at what is wrong, because for us, our expectations are good, good walk test, good good BNP, good hemodynamics. We are very happy with this, but the patient is not happy because the emphasis 10 score is very elevated. So we have, this is helping us to better understand what is wrong, what is the problem. For example, the problem could be side effects, for example. If you have side effects, too much side effects because of sub-Q procyclin, sub-Q procyclin induce sometimes very severe pain. And it is an effective treatment, but it induces pain. So, and this is reflected within the PROM. I think it is important to consider. And we will learn every day much more about how to integrate those results in the care of patients.
So far, what is the reaction of patients when you're introducing PROMs in the routine care? Do most appreciate it? Do some see taking some of the PROMs as burdensome? What's your experience?
Sorry, can you rephrase the question?
Yes. How did you present the introduction of PROMs in routine care to your patients, and what
right.
was their reaction?
No, I think when we discuss with our patient, we just tell them that it is important to have a more precise evaluation of their symptoms and the consequence of the disease on their daily life activities, for example. And they are very happy to feel it. Sometimes some questions are more difficult to understand, and it is a self-administered questionnaire, but sometimes we have to explain more in detail what does it mean. For example, there is a question about the burden of the disease, and sometimes it's not that easy to understand for some patients, and we have to explain, but it is we can explain as a doctor, or the nurse can explain. And now they are very happy to feel at each visit, at each hospitalization, each visit, outpatient consultation, they feel the emphasis 10. So now the people who are doing the 6-minute walk test, they do on the same time the emphasis 10 questionnaire. So for each patient with a 6-minute walk test, we have an emphasis 10.
Great, thank you. Luis says thanks for the nice answers, very helpful. Pisana has a follow-up question. PROMs also have a role in empowering patients. They encourage them to focus on their own experiences and feelings and encourage active self-monitoring and paying close attention to symptoms, side effects, and warning signs. Would you agree?
I strongly agree with you, Pisana. I think it's very important to focus more on symptoms, because symptoms are key. That's more important. And also the side effect, as I mentioned, for example, with subcutaneous treprostinil, but also with others, with other drugs. I think it's very, very, very important. We treat patients, we treat humans. We do not treat patients are not how to say that each patient is an individual, and we cannot have for the same level of severity. You take two patients and you have totally different response to the PROM. I think it's very, very, very important to continue to collect information, and it's a good start in the French registry, more than 2,000 questionnaires. I think that is very important. And Simon Gibb is proposing that PROMs are used at diagnosis. I agree.
Very
And it's very
interesting.
important to follow up with the regular monitoring of the PROMs.
Yeah, and Der from PH Turkey says thank you very much, very useful. And Elena says thank you very much. She was actually a patient of Professor Agner in Vienna, and is grateful to him and his team. I think at least one or two others on the webinar today were also former patients of his. So yeah, thank you to him and to you, Professor Sitbon, and to all of our speakers today for sharing your time and your expertise with us. We so appreciate it. And yeah, I know this is the second webinar we've done together, at least second webinar we've done together. So we look forward to keeping in contact and yeah, continuing these kinds of conversations in the future. So yeah, thank you to all of our speakers. The full video recording will be up later today or tonight on the knowledge sharing platform and on the Alliance for Pulmonary Hypertension's YouTube channel. And then the individual talks as well as the slides will be available later this week in a few days on the knowledge sharing platform. So look forward to sharing that with everyone. And yeah, thanks again for tuning in and sticking with us till the end here. We had a great audience with great questions. And yeah, wishing everyone a good evening and a good rest of their day wherever they are.
Thank you.
Merci beaucoup.